I was definitely pretty high up at, in the division of immunization. I was at the director level. So most people would say, okay, well, you just need to stay. But I kind of felt like there was a glass ceiling at that point in time. It's like, well, what else can I do? Other than go to maybe another department in the Department of Health or move up to maybe the director of the entire division or something like that. So I started exploring my options to figure out, okay, where else can I go in my career? And so at that time, public health was really concentrated primarily in Atlanta because that's where CDC is, but also in Washington, D.C., because that's where all the federal agencies are. So I just started applying to jobs in both areas to see what would pop. And so when I saw this fellowship, people often ask me, like, oh, you went from a director to a fellowship? That seems kind of backwards. But my philosophy is, sometimes you got to go left or right to get up. And, taking that fellowship was probably one of the best things that I could have done to get my career to where it is now. Because it definitely was my segue into the federal government.
Welcome to Public Health Careers. I'm your host, Emory Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all. Welcome to episode 127. Thank you so much for joining me. If it's your first time tuning in, be sure to hit that subscribe button so that you can stay up to date with this latest content. If you get value from this episode or this show, please support the show by leaving a 5-star review. It really helps with the algorithm and getting the show out to new people. Also share this with a friend who would get some value from it. Today, we have a very accomplished public health professional. She has won several 40 under 40 awards. What you'll hear about in her story, but what I truly appreciated was her decision to go from a director role into a fellowship role in order to further her career. Something that many of us don't think about, but I think was very pivotal in her career, and you'll hear more about how that was insightful and helpful for her. As well as we really love people that use a dissertation, research, and put it into action, as you hear more about in the episode as well. So if this sounds like a journey you'd learn from and something that you would want to hear more about, stick around. Enjoy. Today, we have a visionary, award-winning public health professional committed to improving health equity across a lifespan through research, communications, multi-sector partnerships, and leadership. She got her bachelor's in biology from Virginia Commonwealth University. She then got her master of public health at Emory University, and finally her PhD in public health at Morgan State University. She is the founder and CEO of Beacon Public Health, as well as a diversity, equity, and belonging officer at the American Institute of Physics. We have Dr. Jovonni Spinner, PhD, MPH, CHES. Welcome to the show.
Thank you. Thank you so much for having me. I'm really excited to come on and share a little bit about my journey and hopefully inspire others in public health.
We are very excited to have you. You are a great leader in this work, and I know that we're going to talk a lot about your accolades and all the great things that you have won, but I'm excited to hear about the journey and how you got to there. And yes, it will be inspiring for many, many people. So tell us how you're doing and how you've been coping during these times.
Sure. So, today is a beautiful day. So overall, pretty well. Like I said, I'm very excited to be here to share about my journey. It is a journey, has been a journey, and I'm continuing to be on the journey. In full transparency, some days are stressful, but others are blissful. So I try to take things in stride. Of course, I'm a strong advocate for self-care. So I'm making sure I'm taking time out to care for my mental and physical and spiritual well-being as well. But overall, doing pretty well and learned how to cope through these pandemic times. So yeah.
Love it. And would you mind just sharing a little bit about your self-care and what that means to you?
Sure. So I love doing things that bring me joy. So some of those things are definitely like self-reflection and journaling and making sure that, I'm staying true to myself and that the things that I'm doing in my life align with who I want to be. I love being outside. I love going on nature walks around trails and things of that nature. definitely love travel. I'm actually getting ready to embark on a girls' trip this Friday to Mexico, so I'm really excited about that. I'm a foodie, so love to like try new restaurants or treat myself to something nice in those areas as well. So it really is just about being outside, engaging in life, and just living life to the fullest that I can possibly do every day.
Love it. And safe travels and enjoy your trip to
Thank you.
Mexico. You're most welcome. So tell us, how do you identify, and also a little bit about your personal background?
Sure. So my pronouns are she, her, hers, and I'm a Black woman. I embody Black girl magic and everything that that means. A little bit about me professionally. I'm a public health professional. I specialize in minority health and addressing health disparities and health equity. And most of my career I've spent in the federal government. I've recently pivoted to opening my own consulting firm and also doing some nonprofit work. But really, all of my work is done through developing programs that address chronic disease prevention, treatment, and management. That really is my sweet spot. So, figuring out how BIPOC, so Black, Indigenous, and people of color, can live healthier, more fuller lives, hopefully free of chronic diseases. A lot of them are diet related, so hypertension, high cholesterol, diabetes, et cetera, that lead to premature disability and death within our community. So also within that work, making sure that I'm focusing on building relationships, working with the community, the people that I want to serve, making sure they have a seat at the table and making sure they're involved in the program and effort. So we have a stronger program that they can believe in and that they want to be a part of. And so with my consulting firm, that's exactly the type of work that I am doing, creating those trainings, creating those health education campaigns, working with other organizations that want to build up their capacity or providing subject matter expertise for them on any of those topics around minority health and how do we close the health equity gap to make sure Black and Brown people are getting equitable and culturally competent care, how do we reduce those disparities and making sure they have the opportunity to live their best and fullest, healthiest lives.
Love it, and thank you for that work, and definitely very important. And I'm excited to hear more about the long journey in federal work, and then pivoting into starting your own business, which isn't something that I think makes a lot of people excited when they've been in that type of work for a very long time. But I'm interested to hear
Mhm.
like your thought process in going into that. Yeah, that thing, like especially for marginalized populations, I think of public health a lot of way in the sense of like a culture of health and
Mhm.
well-being, and how do we create that culture. And I guess into that point, what does public health mean to you?
So for me, it really stems from the idea that health is a basic right. So from the time that you are born, you deserve to be healthy. So my goal is to make sure that everyone has access to quality, culturally competent health care and all of those social support services that are needed to help people make decisions about their health. I want to embody the spirit of having healthy and vibrant neighborhoods where families can thrive, where you're not having to worry about how you're going to take care of your basic necessities. So, having safe housing where you feel like you can go out and take a walk in your neighborhood or play with your kids at the playground. Having access to healthy, nutritious foods that you can cook for yourself or your family. Having access to transportation and employment opportunities so you can build wealth for you and for generations to come. So, taking care of all those issues so you can live your healthiest life is really what public health means for me. uh, because everyone deserves to be the healthiest version of themselves. I also want people, in terms of public health, is to really think about your health and wellness long before you have a chronic condition that forces you into the medical system. So when we think about prevention, focusing our efforts there, so then we don't have to worry about having sick care, for example, and being forced into this medical system, which a lot of times does push a lot of pharmaceuticals and a lot of there are a lot of other issues there as well. So focusing on prevention and living healthy, that is what public health means for me.
I think the point of that I hear a lot nowadays is more around like pregnancy and saying that the perfect time to take care of a mom or a mom and a baby in pregnancy is even before she gets pregnant. It's really thinking about
Absolutely.
what are all the supports, and like to your point, the chronic diseases, a lot of them are lifestyle based. So how do we change the lifestyles that people are living to have more healthy lifestyle, which are still culturally competent to whatever is healthy to them, but also ensuring that they're not going into this sick care system.
Hmm.
As we know, especially as a marginalized person, you're not always going to be treated the best. But
Right.
that could be an entire other podcast in itself.
Absolutely. Because I mean, when you think about maternal and child health, you want the woman to be the healthiest she can be before she even conceives her baby, because that she is growing a whole life. So we want her body to be optimally functioning, for her mental spirits to be good, for her physical health to be good. So that baby has the opportunity to thrive while it is developing.
Absolutely. Hey y'all, you may be looking for ways to show support for public health, health equity, and this platform, the Public Health Millennial. Well, head over to my shop at thephmillennial.com/shop to buy and support if this show has helped you. Also, use the code podcast for 20% off your next order. Link is in the description to the shop. Be sure to tag me on Instagram at thephmillennial. Thank you. I look forward to sharing your pick. Now back to the show. Yo, are you looking for an online community to connect with like-minded health-focused people? Join my free community health and wellness Discord server at thephmillennial.com/join. You'll find growth-focused people talking about important community and personal health topics, networking opportunities, online yoga, book clubs, and more. Be sure to introduce yourself when you join. Link is in the description. Now really, back to the show. So starting off your collegiate journey, you got your Bachelors of Science in Biology from Virginia Commonwealth University. So tell me a little bit about that thought process of going into undergrad.
So that thought process was an automatic and mandatory one. I always knew I was going to go to college, but in my family, that was your option. You were going to college after you graduated high school. Now, what was your major going to be? That's a whole different conversation. But I always knew it. I come from a very small town in Virginia, and I knew I didn't want to live there for the rest of my life. So I had to figure out, okay, so what do I want my life to look like? And for me, college was that pathway to be able to live the type of life that I wanted to, and to do the type of work that I wanted to do. So even before college, when I was in high school, our high school had a 2-year technical program for dental assisting. So I was a part of that program, and that really sparked my interest in wanting to be in the medical field in some type of way. At that point in time, I wanted to be a dentist. That was it. That was the end all, be all. I focused all of my college searches around dental programs. And so when, my parents and we were discussing college options, there were very few parameters other than, yes, you're going to college, until you need to stay in state for financial reasons. So because of that, we did our research and we narrowed it down, and VCU ended up being my top pick because they had a really good dental program, and they were also in state as well. So that is how I ended up at Virginia Commonwealth University to get my undergrad in biology.
Okay, that makes a lot of sense. So were you a pre-dentistry major? Is that what it was?
Not really pre-dental. I don't think it was like a formal pre-dental track. It was just kind of, the STEM majors. We mostly were on some type of pre-health profession, whether it was dentistry, pharmacy, physician, nurse, etc.
Okay.
So biology was the most logical science to be in to get me to dentistry.
Yeah, absolutely makes sense. And that's a common thought process. I feel like a lot of people going
Mhm.
into undergrad have, whether that is dentistry or becoming a
Yeah.
physician. So heard that like many, many, many times. And then throughout your bachelor's program, did you have any experiences, maybe shadowing dentists and stuff like that? Because you said in high school you were able to do some technical work around dental, something around dental, but during your bachelor's program, did you have those kind of experiences, or what were the experiences like for you during your bachelor's?
So during my bachelor's, I didn't have any exposure to dentistry at all throughout the program. So I didn't really have that connection as an undergrad. So didn't have that at all.
Okay, yeah, that's fair enough. And
I find it always interesting looking at the US system of going into school, especially people who want to be doctors, dentists, nurses, etc. It's like you're going in to do these biology, chemistry classes that aren't really, they're relevant, quote unquote, to some extent, but not really in the bigger scheme of things. It's like maybe understanding the basis for a lot of the things that you're going to learn later on, but I definitely think it's not streamlined. But that might be like a case of trying to weed people out. So did you have any takeaways coming out of your bachelor's degree?
Oh, there were so many lessons learned. If I could go back and do it all again, it would be a totally, totally different experience. So some of those takeaways were, making sure you do your research and pick a school that really fits you in terms of like your learning style. So do you thrive in a small, intimate classroom setting, or is a lecture hall with 300 people going to be okay for you? So looking back, I think I probably would have done a lot better in a much smaller school setting. I mean, I was sitting in lecture halls with over 300 students, so I really felt like you can get lost very easily in that type of system, and not really having the skill set to be able to speak up and advocate for yourself at that time, and really figuring out how do I navigate this massive college system. So I think looking back, figuring out a better support system, figuring out the system, how to engage with it is definitely critical. So I encourage everyone to try to figure that out as early as possible. Really get connected to your professors and see if you can find a mentor or other peer support as well to help you throughout the entire process. Because having that support network is just really, really, really important. And then I think the other thing that was a takeaway was making sure that you enjoy your time. This is probably one of the very few times in your life where you're going to be an adult, have some level of freedom with a little bit of responsibility. When I was growing up, I had an aunt who always told me, don't be in a rush to get into the work world, because once you start working, you'll never stop working. She was very, very true to that. I have not stopped working since I started working at 15. So really taking that time to be able to enjoy your college experience. It's a time to learn. It's a time to grow. It really is a time to figure out who you are as a young adult in a safe environment. You're coming from your parents' home in most instances. And so now this is your opportunity to, kind of figure out who you are without their direct rules in their household, and figuring out what type of adult you want to be moving forward. So just have fun and enjoy it.
Yeah, I think that's great insights. Definitely should have fun. And on that, on
Yeah.
the same note of to your point of being in a classroom that was filled with 300 plus people in it, knowing what you need from a university and then seeking out universities that have that. In hindsight, I wish that you were able to do that, but it seems like regardless, you were able to prosper and continue and thrive on, which we'll talk about a little bit later on. Well, I guess now going forward.
Yeah, I definitely figured it out, but it would have been a lot easier had I had the tools, because I don't think in general high school actually prepares you for college.
Not at all.
Because it's a much higher level of learning. Obviously, it's college, so absolutely there. But it doesn't really prepare you for all of the other nuances that come along with being in college and having to manage your life on your own. So now you're in charge of your feeding schedule. You're in charge of your housing and when you choose to socialize and what time you come home at night and all of those things. And if you move off campus, you're responsible for paying rent and paying utilities and things you didn't have to do before, coupled with trying to, figure out your studies, figuring out which classes to take, should you take morning classes or evening classes, or how does that really work? Like, what's going to work best for you to really thrive in this environment? So, yeah, I don't think high school really prepares you for that. So, kind of like that first year, you're just kind of like, happy to be out, happy to be in college, but you're like, what did I get myself into?
Yeah. That makes a lot of sense. There are so many dynamics that you have to deal with that you didn't have to deal with before going into college. And I guess to that point, and to your point earlier, you learn a lot about yourself and who
Mhm.
you are, and you become the person that that you're going to be in a lot of aspects throughout those types of experiences
Mhm.
throughout your college journey. Okay, so you graduated from your Bachelors of Science and you got a job at the Virginia Department of Health in the Division of Immunization as a
Mhm.
consultant for the Vaccines for Children program. So tell me about that process of getting that first job out of college.
Sure. So it wasn't my first job out of college, but it was like my first traditional, real, like public health
Mhm.
position. And I was so excited. I mean, if you're a public health person working at a department of health, that's kind of like the epitome of public health. So very excited to be there. I came on as a consultant for the Vaccines for Children program, which is a nationally CDC grant funded program that makes sure children who either are on Medicaid or do not have insurance or who are underinsured have access to their childhood vaccines. And so within this position as a consultant, I would actually go around to the different physicians' offices. So I was assigned a region in Virginia, and we would go out and do a lot of different things at these offices. One, we would do a case review. So we'd actually, request a handful of cases, like 10, 20 cases, whatever. I don't quite remember. But we would actually go through to make sure they were giving these vaccines according to the childhood immunization schedule, making sure they were storing them properly, making sure they were, maintaining their inventory properly so there was no evidence of fraud, and making sure they were educated on all of the rules and regulations around this program, and then just providing a support for them to figure out how to best execute the programming for their office. So it could be a health department, a private practice, maybe a multi-office specialty. So really working with them to figure that out. But then from there, I was promoted to be what they call a field operations supervisor. So basically, I was now supervising all the consultants that were going out to do the work over the state of Virginia. And then finally, I was promoted to the director of the program. So I got to oversee all of the operations, making sure not only managing the consultants, but making sure we were adhering to our grant requirements, writing up the grant every year, all the reporting, making sure that, I was managing the budget appropriately, distributing vaccines where they needed to go. I mean, the most hectic time of the year was always around flu season. Because, like, for example, you didn't get all your flu vaccines at one time. So you're getting it piecemeal. So you have to figure out how to distribute that in an equitable fashion. So the most people can benefit from this. So just making those types of decisions and overseeing this large multi-million-dollar grant was very, very exciting.
Yeah,
But yeah.
no, you can continue. Sorry.
Oh no, go ahead. Go ahead.
Yeah, that absolutely is exciting, especially coming out from like a bachelor's program to be able to do that type of work. And like one thing that I wanted to highlight here is that you were able to go with that bachelor's, like go with your bachelor's in biology and go
Mhm.
from this consultant role to managing the consultants to a director position. And I think all of that transition happened within like 2 years until you got to
Yeah.
that director position. So I want to hear from you, like what were the things that you were doing to make yourself so wanted to be a director 2 years after coming out of your bachelor's program? That's not something you hear of.
No, so I'm gonna say probably one of the key factors there was my manager at the time, who was the director. She ended up leaving and going to another role. She saw something in me, and she basically helped groom me to be promoted. You know, I showed an interest in wanting to grow and develop my skill sets and to be a leader and to be a manager. And then she helped me get to those next levels. So I can't say I did it entirely on my own. Obviously I did have the knowledge and the skill set and the passion to want to do it. But like you said, coming in very new, very young. And then when I look back on this, I realized I was in my 20s managing over $20 million. Like
It's
that's
big.
crazy.
Hmm.
At the time, I didn't realize the magnitude of it because I was so on the grind and trying to progress and, trying to get to the next level and trying to figure out, okay, how do I advance in my career and not become stagnant and all those types of things. But when I look back, I realized that was a big responsibility, you know. But I would have to say, having that strong mentoring support, having someone who believes in you can really take you very, very far, because she, helped me learn the systems, helped me learn how to advance through the system, particularly as a Black female, too. So
Yeah, yeah, very, very important having those people above you that can advocate
mhm,
for you as well as like show you what you need to do to fill into those steps.
mhm,
And I guess it's also fortunate that she shifted out of that position and
yeah, she made
just
way for me
yeah,
to have already been groomed and having those skill sets, so then I could be eligible for the position.
yeah, yeah,
Yeah.
absolutely. Okay, so you said that you went into your bachelor's program
Mhm.
wanting to become a dentist. You come out of your bachelor's program,
Uh-huh.
you go work for Department of Health. So what was the thought process like coming out of your bachelor's program before you started working here? Were you like, I'm still gonna try to go to dentistry school, or like you're just trying to find something else in the health related field? What was that thought process for you?
It was a very interesting thought process. So when I got to my senior year as a biology major, I decided that I didn't want to do biology anymore. I didn't want to be a dentist anymore. So that kind of left me at a deficit because I did not have a backup plan, really. Like, I didn't have another field that I was interested in. And so after I graduated, I took some time to try to figure out what my next steps were going to be. And so I started taking these graduate level courses to kind of figure out what can I do with my life, right? Because what 20-something-year-old knows exactly what they're supposed to do with their life? I don't know very many. And if someone tells you they got it all together, they're probably lying. That's just in my opinion. So what I did is I took these graduate level courses. I started with pharmacy. I was like, oh, well, maybe I'll be a pharmacist. That seems pretty cool. So I took like this drug dependence course. And when I tell you I was so bored in this course, I did fine in it, but it just didn't spark anything in me. I volunteered at the hospital pharmacy, and I was just like, I don't want to do this. I'm going to go to the nursery and hold the babies because I just don't want to do this anymore. So then I took this public health course, and it was like something titled like African American issues in health or something like that. And when I tell you a light bulb went off when I took this course, it made perfect sense what my purpose was in life. So my purpose wasn't to really focus on one-on-one individual care like a practitioner, like a physician, dentist, PA, nurse, whatever. My purpose really was to address health from a population standpoint. And so for me to really be able to look at those systemic issues that are driving poor health outcomes, figuring out what those solutions should be, how do you build out, community programming and health programming for communities in need. That's where I made the connection. I still wanted to be in health. I still had a desire for it, but just not in that practitioner role. And so from there, that's when I decided to formally go back to school and get my MPH from Emory, and then, really setting the stage for my public health career to propel into the future.
Yeah, thank you for that. That's a perfect segue because I was just about to drop in. Like, so you got your master's of public health
Mhm.
at Emory University, and I was going to ask when you learned of public health, but it seemed like you learned of it in that one class in your senior year, and I'm guessing then going into the health department. You can.
Oh, no, no, no. I was fully graduated when I took these graduate
Oh,
courses.
okay,
This
okay,
was me
okay.
exploring and trying to figure out my path forward. And interestingly enough, at the time, my mother, she worked at a health department back where I'm from. And she used to tell me how her boss or director at the time or whatever thought that public health would be a good career for me. Mothers, they talk about their kids at work, whatever. And I was like, yeah, mom, I don't know. I don't know if that's for me. Let me just think on it. And here I am a couple decades later doing exactly what my mother has suggested for me to do. So if there's anyone out there who is, second guessing, thinking about, taking their parents' advice, they might know a little something.
That's for sure. That's for sure. Okay, so tell me more about that thought process of wanting to get your master's degree. So you decided to get a master of public health. Why do you want to do that?
So at that point in time, I figured out, okay, public health is my pathway. So I need to figure out, how to beef up my skill set, beef up my knowledge that was specific to public health. Because remember, biology is very much just how the body is functioning. There's not really much interaction on, how are you engaging with people? How are you building programs? It's literally like, you know, how your body's working.
Mhm.
So that's what really sparked my interest to go back and get my master's in public health because I had finally figured out, okay, this is the path that I want to embark upon. And I want to make sure I have the education so I can get the types of jobs that I want.
That makes a lot of sense. And going into your MPH at Emory, did you have a concentration, and what was the thought process in choosing that concentration?
My concentration was more on the prevention track. I forget what they called it at the time because we had three tracks. I think it was like prevention, epi, and maybe maternal child health. So it was definitely more of that behavioral interventions, prevention type track, but definitely a broad enough program where I could have done pretty much anything.
Okay, that makes a lot of sense. And coming out of your MPH program, do you think it provided everything that you needed, or at least there was additional skill sets and tools that you needed?
I would say, looking back on my career, that level of foundational training was critical. It gave me everything I needed, honestly.
Okay, that's perfect to
Yeah.
hear. That's good.
I
Good.
mean, I definitely have to, shout out my alma mater. So if you're thinking about a wonderful public health school, Emory is great.
It is a good school. That's for sure. That is for
That was
sure.
part of my decision making process. I decided I wanted to go to a top 10 public health school. And so I applied, and Emory was the best fit for me at that time. And I'm very happy. And the relationships I built there, I still keep in contact with my classmates, now colleagues, and even some of the professors as well. So definitely a great experience for me.
Awesome, awesome. Reach out to Jovonni if you want to know more about Emory.
Yeah.
Okay, so you got a fellowship as a health policy analyst at the Department of Health and Human HHS, Health and Human
Mhm.
Services, National Vaccine Program Officer. So how do you was this after you graduated from your MPH, first of all?
Yes. So interestingly enough, so I was definitely pretty high up at, in the division of immunization. I was at the director level. So most people would say, okay, well, you just need to stay. But I kind of felt like there was a glass ceiling at that point in time. It's like, well, what else can I do? Other than go to maybe another department in the Department of Health or move up to maybe the director of the entire division or something like that. So I started exploring my options to figure out, okay, where else can I go in my career? And so at that time, public health was really concentrated primarily in Atlanta because that's where CDC is, but also in Washington, D.C., because that's where all the federal agencies are. So I just started applying to jobs in both areas to see what would pop. And so when I saw this fellowship, people often ask me, like, oh, you went from a director to a fellowship? That seems kind of backwards. But my philosophy is, sometimes you got to go left or right to get up.
Mm.
And, taking that fellowship was probably one of the best things that I could have done to get my career to where it is now. Because it definitely was my segue into the federal government. And so going into that position, I was doing health policy work around vaccine financing and supply. That was around the time of the H1N1 pandemic. So, like working with pharma and others to figure out, how we're going to finance this. What does the supply look like? Working with the National Vaccine Advisory Committee on their work as well, and then working on some other projects as well.
Yeah, that's awesome, and I like that you were strong stead in the sense that you didn't listen to what other people said, going from a director to a fellowship position. And I think like even especially considering that you were coming out with like a bachelor's degree into this director position and this fellowship, I feel like fellowships just provide such a broad range of
Mm-hmm.
knowledge and networking opportunities that, like, to your point, you were able to learn a lot throughout that process and gain a lot, and also just get more experience in a different part of like the public health system, which I think is important to note. Don't listen to everything everyone else has to put on you.
Exactly. Yeah. So it's very important that you figure out what your path needs to look like. Society will tell you you need to do X, Y, and Z by this date, by this time in order to be successful, right? But that may not be what you desire, right? So you need to figure out for yourself, what does this look like? So that goes back to what we talked about earlier around self reflection and journaling. And I'm big on vision boards. I do a vision board every year to really map out what I want the next steps in my life to be, and then figure out how do I get there. I would say taking this fellowship in DC was extremely scary because one, it was taking a step back. I took a fellowship that didn't have any benefits. Let's start there. I had to pay for my own health insurance out of my pocket. This was before the Affordable Care Act, I'll just say. And then also moving to a city where I knew absolutely no one. Like, I literally packed up my life in Richmond, Virginia. In 30 days, I was in a whole new geographic area. And again, starting from scratch, trying to figure it out. And I actually didn't even know who my supervisor was going to be. Like, I got interviewed, obviously, but it was over the phone. We never met in person. So I'm showing up on day one, just sitting in the lobby, like, I don't really, this is before LinkedIn and social media and all that type of stuff. So I'm just sitting here, just like waiting for her to come down the elevator. But even though it was scary, it ended up turning out to be a good experience.
That's good. That's good to know. And I think like to emphasize your point of saying like if you have a plan for your life or a vision, like
Mhm.
you follow through with that. Like if you're doing reflections and understanding, okay, these are the reasons why I'm doing this, and it's not because of external factors, it's because it's something that
Mhm.
I want to do, like do it. And
Yeah,
because you're not going to regret that in the long term.
yeah, because you only can live your life for yourself, right? And not everybody is going to recognize the power of your dream. They're not going to be able to see your vision. But you know your vision. You know you have steps. You know what you need to do to get there. So you follow your own
Yeah, absolutely, absolutely. And then after
path.
this fellowship, you got a role as a public health analyst at the
Mhm.
National Institute of Health slash the National Heart, Lung, and Blood Institute. So how do you come across this, and what did you do in this position?
So interestingly enough, so my fellowship was coming to an end. They usually like you to stay around 2 years. So I was around that 2 year mark. So I was figuring out, okay, what next? Working downtown DC in Department of Health and Human Services. It's a little bit different than working for one of the other agencies like NIH, SAMHSA, HRSA, just because those agencies are more, programmatic focus or research focus or whatever. So I was just looking for a position that, I could expand on my skill sets. I wanted to shift from policy because policy to me was very gray. There is no real definitive end. And so as an outcomes oriented person, at times that was very challenging in the beginning. Because I was like, so well, what happened? Oh, so we're just supposed to brief senior officials and give them all the information. So that's the job. I'm like gung ho, like, what's the policy gonna be? Let's see this to the end. It's like that's not really what it is in that particular role. So, I had to have some conversations with myself to readjust my thinking. So then, anyway, so I started looking for jobs, and this is where again networking is very important. I actually had a very good colleague, help frame some things out for me in terms of what a federal career looks like. And she told me one day, she said, you can have all the skills, all the knowledge, all the abilities in the world, but if you're not able to work well with people, if you're not able to build relationships with people, you're not going to be able to get any work done. And she said, what I see in you is you are a relationship person. You are a people person that you can get people who may be on opposite ends of the spectrum to be able to come to a consensus on the topic. And that will take you much further than your degrees and accolades, et cetera, et cetera. So then I ended up, networking and figuring out where I wanted to be next. Saw this position at NIH in the Heart, Lung, and Blood Institute, and it was absolutely wonderful and magnificent, the type of work that I got to do there. I started off doing more data analyst type work, and then I transitioned into more program management work. And it was just a very, very good fit for me.
And it sounds like the policy work of like bringing people together and sharing that the issue was something that kind of was important in the role. Granted, you didn't enjoy policy work because it wasn't as tangible, which completely makes sense. Like
Absolutely. So when I moved over to NIH, it was all so tangible because when I first came there, so we were working on this program, the Community Health Worker Health Disparities Initiative. So this initiative trains community health workers or lay people to be able to educate their community members about heart disease risk factors. And then we also did asthma as well. So it's very tangible. The curriculum was already created. So when I first came in, they said, hey, we have all of this data from all of our programs, all the different strategies we've implemented across these different communities. Go analyze it. Tell us what happened. Okay, I can do that. Great. And then once I went into more of the program management side, it was like figuring out the next steps. So able to create like this champions program to figure out how can we expand on the original strategy. What are some additional best practices that we can use for each of these communities? And, we were able to develop some really innovative partnerships. And one of the ones that was the most innovative for me was our work with HUD, Department of Housing and Urban Development. I mean, who would think NIH and HUD would be working together? But we know housing is a social determinant of health, and safe housing is very important for health outcomes. And so we work with a lot of the local housing authorities, and we were able to train residents who then, went out and did the programming. And actually, some of them were even able to stimulate policy change. So there was one housing authority in particular in Boston that we had this 12 session curriculum. But what they thought was most important was the section around smoking. So they used that first and to rally support, and they were actually able to implement a smoke-free housing policy. So it just really goes to show how health, has such an impact on other areas. And who would have thought they would have, been able to implement policies that will now impact everyone who lives in that housing authority. So that goes back to like the whole relationship building, being able to provide supports for other people and seeing what their actual goals are for their communities and being able to support those. So even though initially they didn't take all 12 sessions, they took one, but that one session had such an impact. They went back and did the other sessions as well, but they just started with smoking.
Okay, that's awesome, and thank you for that example as well. And so after this position, or might have been during this position, you decided to get your PhD in public health at Morgan State University. So what was that thought process for you of thinking, okay, let me go get some more education on public health?
Exactly. Who wants to put themselves through that process, right? So I actually started my doctorate program when I moved over to FDA, but the rationale behind that was it was very much a personal motivating factor because, I was pretty far along in my career. I didn't actually need the PhD to get to the next career level per se. So for me, it was more of a personal gratification. Can I do this? Can I complete this? And then partly professional development to ensure that whatever position I ever wanted in my life, education would not be a limiting factor. Because there's nothing past a doctorate degree along this trajectory. And so that is why I decided to enroll in Morgan State's doctorate program. And I loved the program. It was very, attending the HBCU was very good, right? So going into the classroom and not having to explain my lived experience, having people who already understood and recognized what the challenges are being a Black person in America, right? And then being able to couple that with the learnings of public health at the next level. All of that was very influential in my thinking and in deciding on how to, take those next steps in my career as well.
Okay. And given that perspective of this just being something that you wanted to do more for yourself than something that you needed for like career progression, when someone does come to you and ask you about getting a doctorate and they don't necessarily need it for career progression, what advice do you give them around that?
I would say, think about it, pray about it. No, I would say just really understand what your personal motivators are for why you want this degree, and understanding the time commitment, understanding it is going to be hard, it is going to be stressful. It's just a challenge, right? And I work full time during my degree. So I went to school full time and worked full time. And there was a commute in between that. So I was driving, from Silver Spring to Baltimore, an hour plus each way, several times a week, in addition to the coursework as well. So it's absolutely doable. But I would just say, really think about, what are your motivations for this, and what do you want to do with it when you get that piece of paper?
Yep, love it,
Yeah.
because I think you really need to know why you want to do it.
Mm-hmm.
As like going back to what we were saying earlier, not focusing on those external factors, we're focusing on it for you. Like
Right.
even if it is like you want to do it for the vanity, but understand that okay, that's what I want to do it for, and that's what I'm going to do it for,
Mm-hmm.
and do it for that, as opposed to doing it for someone else's reasons. Yeah.
And, also recognizing that it's a financial commitment as well. You may not get 100% funding. So are you going to be okay either paying out of pocket or figuring out student loans and taking on that? I say additional debt, assuming that people have other student loans like myself. But, there is a financial component to it as well that you need to really, really think about.
Yeah, that definitely is an important factor as well. And you alluded to a little bit earlier. So while you're doing your PhD, you were an associate director for outreach and communications at the FDA, Office of Minority Health and Health Equity. So tell us how you got into this position and what you do in that one.
So while I was at NIH, I was thinking about, okay, so what do I want to do next? I kind of wanted to work at multiple agencies throughout my career. And so I actually came across this position. It was a newer office. It was founded under the Affordable Care Act. So under the Affordable Care Act, all of the HHS offices had to have an Office of Minority Health, and NIH's office was elevated to an institute, so NIMHD. And so when I saw this job posting and I'm reading through it, I'm like, this is everything I want to do. This is like perfect alignment. Like, did someone actually write this for me? And so I couldn't not apply to the job. And I'll be honest, at the time, I didn't really have a desire to work at FDA because I had a very specific view of FDA. It is a regulatory agency. We often call it the stealth public health agency because most people don't naturally associate it with public health because of the regulatory piece, the regulatory mission. And so I was like, you know what? Let me take a chance. It's minority health, is doing all of the type of work that I want to do, but under a different umbrella, using a different lens. So NIH is the research, right? So FDA is the regulation. HHS was the policy lens. So this gave me another avenue to be able to address public health. So I took that opportunity. It worked out. They selected me. And from there, our team was able to do some amazing work. We did a lot of work around clinical trial diversity and raising awareness about why we need diverse participation. Did some phenomenal health education campaigns around clinical trial diversity. And right before I left, we launched a lupus and clinical trial diversity campaign. Again, those stakeholders. making sure that minority groups had the opportunity to engage with FDA in multiple levels, having that bi-directional feedback. So it's not just FDA presenting to you, but you are being able to influence our agenda as well. So being able to work on all of those different projects was really, really exciting, and really being able to advance the health communications within our office. So like I said, it was a newer office when I came on board. So being able to help it grow and mature over the years, and seeing staff also grow and mature over the years as well was, very rewarding. And just seeing the portfolio of work, like, developing all of these fact sheets and health education materials and brochures and infographics. So we had different kinds of health education materials to meet people at their place of need. So if you were getting your information online through social media, we were there. If you like digital information or want to print out something, we also had that as well. Going to the conferences and the health fairs and things of that nature, making sure that, we provided those materials to others who were doing that type of work, and therefore expanding our reach, and, making sure that diverse communities have access to credible health information that's easy to read. We translated it into a bunch of different languages, at a minimum, the top 5 spoken languages in the US, and making sure that, they were all culturally competent. So we're using images that look like our communities, right? We're using examples that are very community centric and focus on culture as well. The same thing with translations. Making sure that it's not a word for word translation, but we're taking culture into consideration. These are things that are typically not always thought of, particularly in a very science and technical organization, because you absolutely have to maintain the scientific integrity of the information, but you also have to be able to explain in a way that somebody can make a decision about it, right? Because you're not just talking to other health professionals that look like you're talking to consumers. So you have to be able to break down that information. So that was pretty amazing, pretty fascinating. Definitely loved working there as well. I have to say, I'm just going to pause and say, I have been very fortunate, and I recognize my privilege in being able to have a public health career that so closely aligns with what my personal passions are. Like, every job I have liked, every job has helped me build and grow into something else. And when you think about all of the components of public health, being able to have positions that touch many of those core competencies is really amazing. So when I talk about building programs from the ground up all the way to sunsetting them, having that opportunity, I don't take lightly or for granted.
Yeah, I appreciate you sharing that. That is so true, because since public health is so vast, there's so many different ways that you can fit in there. And since it is a competitive field and getting more competitive as we speak,
Yeah.
it truly is. That I'm glad that you acknowledge that privilege of being able to fit into those roles that really align with the things that you wanted to do. Because not everyone has that opportunity. But at the same point in time, I don't want to take away from your story of you doing amazing things to get these positions and putting yourself in those spaces to get the positions as well.
Thank you.
You're welcome. You said that you did this role at the FDA while full-time, while you did your PhD full-time. So how do you balance and get through all of that?
So I would say, a couple of things. A lot of scheduling. So being very mindful of where I need to be, first of all, physically. What days do I need to go to class, that sort of thing. But also setting aside time to be able to get the work done. So you hear about people say they have a 9 to 5 and a 5 to 9. So my 5 to 9 became my dissertation studies, my coursework, for example, my internship, and then working on the weekends. I remember there was one semester I took biostat, and it probably took me 8 hours every Sunday to do my homework. Probably cried on most of those Sundays because I don't know what he was asking me. And that was so challenging. I was like, why are we doing this? I get it. You gotta know the theory, you gotta know, the applications behind the software. But it was, yeah. So, set aside those times and adjusting my actual life, right? And learning to let go of certain things. So it may sound trivial, but one of the things I let go early on was the yard work. Like, I can't do the yard work. I can't cut the grass and trim the bushes and all that type of stuff. So I had to hire someone to do that, right? To take some of that burden off of me. Then, thinking about other things. Okay, so yes, I love an absolutely clean house, but I can't be so caught up that I got to pick up every little piece of thing every day when I could be studying, right? So just finding that balance where you can say, okay, this is not as important right now. You don't have to completely let it go or whatever, but my energies need to be invested over here for right now. And this is only a, small piece of my life. So this, it has an end date. In my mind, I was going to be done in 4 years. That was the earliest you could finish your program. And I said, well, I'm going to do that. Now, one semester I was kind of out of my mind and had this crazy thought that I could take 4 classes. I don't know what I was thinking that semester. I finished, it was fine, but it definitely was a challenge, right? So it really was about maintaining my schedule. Sometimes you do have to say no to your friends. Hey, can you come out and go to dinner? Well, not tonight, but we could do it another night, so just kind of those kind of checks and balances, and then making sure you're also taking time for yourself as well, because you
Yeah.
can get burnt out very easily.
Yeah, I can imagine with that responsibility of both doing a PhD program, which is very taxing, and then working a full-time job it's not like an entry-level job either, it's an associate director level job. So
Yeah, and it's a lot of responsibility with that position as well. So, I'm basically, leading this program. I have staff that I have to provide leadership and direction for and set the vision for the team in the program as well. So, and then also engaging with senior leadership throughout FDA and being able to push some of these initiatives and programs forward. So it is a big responsibility.
yeah, and I appreciate like the tangible advice around like time, like you only have a limited
Mhm.
amount of time, prioritize and figure things out that
Yeah.
way, as well as I appreciate you sharing that biostats was still hard for you as a PhD student, because I think people need to hear that you don't have to know everything in public health, but just know enough for certain things and more in the things that you're trying to like excel in, which is important.
Right. And I think you mentioned earlier there are so many different paths that you can take in public health. So yes, you do have to understand the fundamentals and the core competencies, but that doesn't mean because you had to take biostats, now you have to have a career in biostats, right? Or you had to take epi, so now you have to be an epidemiologist. No, you can find your niche and figure out where those jobs are and go get that job there.
Absolutely, absolutely. So you're also a public health speaker. You've been speaking for, I think, almost 15 years now on a bunch of different topics, health disparities, health equity, minority health, cultural competency, health literacy, etc., etc. Go check out Jovonni's LinkedIn profile if you want to see everything. Tell me how do you get involved in speaking? How'd that come up as a thing for you to do?
So it kind of started organically, like with trying to be on the conference circuit. So, part of being in the government space, you want to make sure that, your research, your programs, other people know about them, right? You want to get publications, you want to then take those and then present at conferences. So it started off with like submitting abstracts to like APHA, for example, and then it kind of blossomed into other conferences, and then being invited to speak at different meetings, conferences, symposiums, and things of that nature. So it kind of started organically, and then it just flourished from there.
Yeah, that's
Yeah.
awesome. And yeah, that I like the point of view, like just wanting to get out there more and then
Mhm.
realizing that this is a way for you to get out more. And to that point, like generally speaking in your PhD pro, in your PhD program, you're going to be doing a lot of writing and
Yeah.
a lot of opportunities to share the research that you have been doing. So like, why
Yeah,
not use that as something that's also going to benefit you like professionally, personally as well, and especially if it's something you like.
absolutely.
Okay, so being a speaker for over those 15 years or almost 15 years, I should
Mhm.
say, what are some of the key learnings or things that you've taken away or that you'd like to share with the audience?
Um, let's see. I think some of the key learnings is knowing your audience. So when you are presenting, making sure that you tailored your content for them. And so when you're thinking about developing your talk, what's going to be most important for them? What is their call to action? Always have a call to action in whatever you do. So when you leave, my talk or my presentation, here's what I want you to do with this information, right? Um, and then figuring out how to scale up and scale down based on your time. You need to have your elevator pitch. So if you run up on a director and you want to get funding, have that ready all the way up into maybe your, hour long, 90-minute talks as well. And then everything in between and being able to get your point across quickly, but making sure that, it is something that people can resonate with and understand. And that is, easy for them to take take on that information.
Right.
And then also make it as engaging and interacting as possible. People don't want to be talked to, you know, engage the crowd, ask them questions, get them, spark their interest around the topic that you are doing and being able to pivot if you need to. If you see that your audience really wants to go deeper into this one point you were talking about on your presentation, be able to do that. So then they feel like, okay, I'm getting more out of this than me just sitting here, just getting some other information. And then also using those opportunities to build those connections. A lot of the connections come after the talk. So when people come up after you and say, oh, I really enjoyed this, or oh, I want to learn more about your work. And then from there, you can build a new relationship and there's possible opportunities for collaboration on another project or for them to be able to adopt your work, for example, and maybe replicate it in their setting. And so you can amplify the messages. So I would say just knowing your audience, tailoring your content to meet their needs, make sure you are interactive, engaged, and add your personality and your flair to it. You are a human. Oh, and most importantly, don't read off the slides. Everybody can read. Sounds like common sense, but you'd be surprised at how many presentations where I'm just like, they are literally reading off the slide in the most monotone voice possible. Use storytelling techniques, tell a story about why this is important and what the impact could be, and infuse yourself in the presentation as much as you're comfortable as well. So then they can connect with you on a human level.
Yep, love that. That's some great advice. And more recently, you became an adjunct faculty member at Pacific College. So how do you come across that, and what do you teach, and what are some like learnings or experiences that you had throughout this?
So I always had this desire to be an adjunct faculty once I started in more of my advanced academic career. But getting into academia is very hard. It's very challenging. It's almost like you need to know someone to get in the door. And so I saw this position open up and I applied. And, as part of my interview process, they asked me to put together a mini lecture for them. And I had to deliver it and everything. And so from there, they selected me and I teach a few different public health courses. So I teach one on social determinants of health, one on healthcare disparities, one on public health programming, and then I'm getting ready to develop a new course on health communications and advocacy.
Okay, that's quite a range
Yeah,
of different topics there. And what like class level are you usually teaching?
they're undergraduates.
Okay, that's awesome. And yeah, go ahead.
Oh, and I was gonna say, in last semester, I actually was able to open up one of my courses, the Social Determinants of Health course, up to faculty as well, because it aligned with some of the organizational priorities that the institution wanted to put forth. And so that was pretty exciting to have actual faculty and students in the same course. I'm sorry, it was healthcare disparities. I think one of the two. I don't remember.
That's okay. That's okay. I think the fact that you got the faculty and the students in the class together to learn together is something that's admirable and awesome to see. So you're also a diversity, equity, and belonging officer at the American Institute of Physics. So physics, first of all. So because we haven't heard anything about physics throughout this entire conversation today. So
I know, right?
Tell me more about that. How do you come across this, and what do you do in this role?
It's an interesting pivot, right? But there's a connection here. So before I took this job, I mentioned earlier that I do a lot of vision boarding, right? And a lot of reflection. So I had decided that my next position I was not going to apply for. I wasn't going to find it. It was going to find me, right? And so this is another lesson: the power of your networking and the power of your LinkedIn profile. If you don't have a LinkedIn profile, you're not looking for a job. I'm sorry, you're just not. So I strongly encourage everyone, make sure you have a very strong LinkedIn profile. So a recruiter reached out to me and said, hey, we have this position we think you would be a good fit for. So I was like, hey, tell me more. I'm interested. Interested in learning about other opportunities. And, we talked about the position, and I said, oh, that could be a good fit. That could be a good pivot for me. And so went through the whole interview process and started the role as the DIVA officer, so diversity, equity, inclusion, belonging, and accessibility. It's very much a mouthful, right? But all things diversity. And really my role is to make sure that we have the programming and infrastructure to diversify the physical sciences field. So we primarily obviously focus on physics, but also astronomy and other physical sciences. And AIP, the American Institute of Physics, we are a federation. So that means we are an organization of organizations. So we have 10 what we call member societies that represent different disciplines of physical sciences. And so part of my job is to support them in developing their DEI strategies and making sure that we are creating these welcoming and inclusive environments to make sure that Black and Brown students are able to persist through their undergraduate degree and also support them in their career once they graduate. So right now, what I'm working on is our DIVA strategic framework, which will set the tone for the work for the next 1 to 5 years to come. It is a relatively new office, so it is a new role. And so that was part of the appeal for me, to be able to come in on the ground and help build something that was sustainable and that's meaningful, particularly almost like a full circle moment, because I started in biology in a STEM career, and now to come back many, many, many years later and be able to figure out ways to change the culture of how students are interacting within their STEM departments.
Yeah, that's really cool, and I think it's also really cool that like throughout your entire career, you're doing a lot of like public health, more public health focused. Granted, your work right now is very public health because it's diversity, equity, belonging, accessibility officer, but you're able to find like a niche in physics or in an organization that focuses more on physics, or something that's not really or not particularly public health focused, but there's still public health work that's going into there, as well as that's awesome that you're able to get reached out by from the recruiter. And that, yes, work on your LinkedIn profile, everyone.
Yeah. So, and I think it really is a testament to how you can transfer your skills into different industries. So sometimes public health jobs may not look like public health jobs on paper. And this is not a public health job by any means, but some of the same principles in me addressing minority health and health disparities, those are some of the same principles I can use to address DEI issues in the STEM field. So making sure you're keeping an open mind and thinking through, like, where can you find jobs? There are other industries where your skill sets can certainly be transferred and applied. So don't limit yourself to just thinking about public health in this very narrow lane, but thinking about it, there are highways and there are byways and bypasses and all these other avenues to get you to a fulfilling career or job.
Absolutely. Great insights there. And a little bit before you started that diversity, equity, and belonging and accessibility officer, you founded your organization, which you're a founder and CEO of Beacon Public Health. Beacon Public Health creates customized solutions to help organizations address the pressing health needs of BIPOC communities to advance health equity and reduce health disparities. Where did this come up? Because I know you mentioned earlier in the interview that you were in the federal government for many years, and then you're like, okay, I'm stepping out, I'm gonna do this work with this physics organization, I'm gonna do my consulting. How did this all come up for you?
Okay. So, in general, people think you are out of your mind when you say you're going to leave the federal government. They're like, oh my gosh, you're going to leave your good federal job? And I'm like, there's life outside of the federal government. Don't get me wrong. I enjoyed my entire federal career, but with any organization of that magnitude, there's a lot of bureaucracy, there's a lot of red tape, right? So one of the motivating factors for me to found Beacon Public Health was to be able to work on the projects that I was most passionate about, to be able to pick and choose which organizations I was going to work with, what type of content I want to push out. So one of our very first campaigns was last year called Unwind with the Tribe. And so that really focused on Black women and obesity and overweight, right? But really looking at it through that social and cultural lens. And one of the events that we had was this 3-part Instagram live series where I had experts that were Black women who were professionals, but also had the lived experience of a Black woman talking to other Black women so we could have a conversation about what does it mean to get access to care? What does it mean to be physically active and, addressing our health and our wellness? What does it mean to manage our mental health as it relates to our weight, right? What does it mean for nutrition? So I had a therapist and nutritionist and a yoga instructor and a healthcare clinic and others coming to talk about these very pressing issues, but in a very real world way. So it wasn't like this presentation. It was very much, conversational. It's Instagram Live. So, you get in there and you talk, but it's professionals. They are skilled in this area, but also, again, have that real world experience that they are also navigating through these same issues. And so with that campaign, there was also collateral health education materials. So there was a research brief, there were social media graphics, there was a website design for it and everything. And it really was just to have an opportunity to look at health education in a slightly different way and making sure that it's designed by us for us. And I'll also say that I was adamant about not having my dissertation live on a shelf. So now through my company, I have the means and the conduit to be able to create a health education campaign that was centered on my research in a very tangible way that the Black women who were a part of my research study, I can now translate those findings for other Black women, right? So who's going to read a dissertation? Only people who are reading dissertations are the people who are working on their dissertation because they want to know what they look like. What are you supposed to do? How do you get to a few hundred pages of writing, right? Those are the only people. No one else cares. They sit on the shelf. They sit at ProQuest. Nobody cares, right? But I wanted to make sure that those findings were going to come to light if that was the last thing I did. And so that was one of the other motivating factors for developing this campaign.
Yeah, completely agree with that. Yes, yes, yeah, and I love when people are like actionable around their dissertations, or like not just using it as this one thing that they have done and then
Mhm.
nothing else happens with it, but actually using it to
Yeah.
build off of or actually do work in the field around. So tell us more about your dissertation.
So my dissertation was examining the social and cultural factors that impact weight among Black women who were living in Prince George's County. So I did a qualitative case study. So I did a interviews with women. So I had 15 women in the sample. So I did interviews to ask them about their social and cultural factors that influence their decisions around their weight, particularly as it related to physical activity and nutrition. And then from there, I did focus groups to further delve deeper into those conversations around those same topics. And a few things that I found out of that study is that social and culture are very important when you're thinking about how you're managing your weight, how you view your body, how you want to live your life, for example. So many of the women, you know, they didn't necessarily ascribe to the BMI chart, right? So BMI, body mass index, which is a measurement of your weight versus height formula, right? But more so, they wanted to focus on being healthy so they do the activities they enjoy, so they could play with their kids, so they can live longer, healthier lives with a better quality of life. You can live long with a chronic disease, but it's not a great quality of life if you are always feeling ill and worn out, you're on a bunch of different medications and all the things that chronic disease. So as much as they prevent them, they wanted to do that. And really focusing on, okay, so what are some of those cultural traditions that we had growing up that we want to keep in our lives, or others that we want to alter to make sure that we could maintain our health and wellness. And one of the common themes was, food is a part of our socialization, right?
Mhm.
Whether it's a happy occasion, like a graduation, a wedding, a birthday, or something sad, like, oh, I lost my job, oh, I had a bad day at work, or oh, there was a death in the family. Any of those occasions, we can typically rally ourselves around food of some sort. But now, so keeping that culture, keeping that tradition of using food as a center of our communications and socialization, but doing it in a slightly different way, doing it in a healthier way. So those were some of the findings, and hoping to share those findings to inform future programming efforts. So when we're thinking about designing, curricula for health and wellness for Black, don't leave out the culture piece. Make sure that piece is in there. It's not just oh, you need to lose weight. Oh, you need to engage in physical activity. Well, we all know that, but it's the how you do it. I'm a busy Black woman. I work full time. I go to school. I have children. I have family responsibilities. I have household responsibilities. I may have a partner, all of those things. All right. And I'm a Black woman living in America. There are stressors that come with that. So let's not negate that fact. But how do I take all of that and figure out healthy strategies for me? How do I tap into my social network for accountability purposes? Because we're all in this together. We're all trying to be healthy, right? I've never met a person that's like, oh, I really want to be unhealthy. Oh no, I can't wait till that hypertension kicks in. People aren't around saying that either. But it is very challenging. And some of those common challenges came out in my research as well, in terms of like time and desire and access. So even though this was a group of high income women, they still had some of those same challenges. So figuring out how to overcome those, but also not giving up on who we are and how we were raised as well.
Yeah, that's some important work there, and it's awesome that you highlight that, because I think many of the times we think of like just BMI, but then how is that? And it's not really actionable for someone in the same sense as having a conversation with someone else as interviewing, and like the motivational interviewing came up, and
Mm-hmm.
it's like, what's important to you? Okay, so what are the things that we can do to, whether that's get you to walk with your grandchildren or these kinds of things that are more actionable but are still healthy and are needed. So really shifting that. And I think to your point, it's very important that we still focus on the culture, because it is the culture that has gotten us to where we are, but we still have to use that culture to try to get more positive, more beneficial health behaviors and health outcomes, because a lot of the times it is the environment that you're in, and then those habits just develop, and it's very hard to get out of those habits. But anyway, like I could go on
Yeah,
and on
I
that.
think we could probably have this conversation like all night.
Absolutely. But yeah, but like just to close everything off, like I'm really happy that you're able to like do this research, and then not only just do the research, but say, okay, this is something that I've done a lot of research on. Let me see how I can make it actionable, and then creating this organization, Beacon Public Health, to really drive that forward and drive forward other initiatives that you're probably not getting as much public health work, as you said, in the current role that you have with the American Institute of Physics. So I think all of that makes a lot of sense. Tell people firstly, how can they find Beacon Public Health?
So our website is beaconpublichealth.com. You can find us on all social medias under Beacon Public Health. So we're on Twitter, Instagram, LinkedIn, and Facebook.
Okay, awesome.
And if you're interested in working with us, you can fill out one of the info forms, and we're always looking for bright consultants. So if you're interested in being one of our consultants, you can reach out to me and I'll send you the form.
Okay, awesome. And just to reiterate, what types of like work or projects can people work with you at Beacon Public Health to do?
So pretty much everything from A to Z. So program evaluation, program design, it may be ad hoc consulting on a particular topic. Definitely a lot of professional development trainings around different topics. So maybe like how do you use social media to as a health education tool, for example, or other trainings around health disparities or health equity, and on building up the skill sets of public health professionals, because a lot of this stuff isn't a part of our curriculum. And so you don't realize what maybe some of the issues are until you're out in the field and you're working with diverse communities. You figure out like, oh my gosh, like I don't really know what some of the challenges are. I don't know where some of these root causes are. It's not, oh, this is not the individual's fault. This environment they live in that they have no control over. So having those training opportunities as well.
Okay, awesome. And earlier in the episode, I said that that's a big deal that we talk with Jovonni today. She is 40 under 40 for 4 different programs. So that's 40 under 40 for National Minority Equality Forum, for the Beaumont Foundation, for the Prince George's Social Innovation Fund, and for Emory alumni. So tell us more about the experience of being a 40 under 40, or what advice would you give to someone who like aspires to get these types of accolades in their career?
So I would say be authentic in the work that you're doing, and the accolades will come. So everything that I've done is because I'm passionate about it. I want to be the best that I can possibly be of service, and really this is just my passion exuding out into a professional workspace. So once you do that, I strongly believe that the accolades will come. Now, some of these do come as a nomination process. Some nominated by others, so you may have to be able to communicate why you are deserving of one of these awards. And it's not just the X under X awards either. You know, there are other career awards. APH has a lot of awards, for example. There are other organizations that recognize public health professionals. So making sure that you can articulate, you know, what your accomplishments are, why you're doing this type of work, what impact are you making on public health and society at large.
Yeah, well, thank you for that, and I feel like your work speaks for itself.
Thank you.
and in that, where would you like to see yourself in the future?
This is a good question. If I could be a global thought leader, that would be the ultimate career for me, and really making sure I'm able to focus on making those systemic changes that really transform our healthcare and our public health infrastructure. If I can work towards that, then that is what I want my future to look like. Now, albeit a very, very, very big goal, so I'm probably going to have a lot of work probably until the day I die. But as these systemic inequities don't resolve themselves overnight, but that's where I want to have the biggest impact.
Okay. Well, we look forward to seeing you do all that great work. We completely believe in you. So I'm looking forward excitingly to see how all that progresses in the future. And then moving you on to the Furious Five, the last section of the show. Number one, what advice would you give to a student trying to pursue a career in public health?
Just do it. We need more diverse professionals committed to doing the work. I would say definitely find your niche. So ask yourself, what are you passionate about? What problem do you want to solve? And from there, find a job that aligns with those goals. Find you a mentor, find you a sponsor, find you someone who will help you along your journey. Find multiple people, actually, not just one person. And really think outside of the box when you're looking for jobs, because many public health jobs may not be labeled as such. Whatever reservations you have, put them aside and just go forth and do it.
Love it. Number two, if you're talking to someone wanting to get into your position, so that's both as CEO and founder and as the diversity, equity, belonging, and accessibility officer, what advice would you give them?
So I don't know who said this first, but your network is your net worth. So you need to build a strong network of people that you could tap into later. And when you're building this network, value too, don't be in a position to just take, or only ask them for stuff when you need it. Check in with them. Let them know where you are along your journey. Me as a mentor, I love it when mentees come back and say, oh my gosh, I got this new job. This is what I'm doing now. Because we want to hear about those and how can I support you along your journey. You're going to be better off to build those relationships that way versus I haven't heard from you in 5 years and now you want me to write you a letter of recommendation. I have no idea what you're doing. Are you even the same person? Do I want to attach my name to you? I have to think about those things when people ask me to do stuff. I've literally had people reach out to me blindly on LinkedIn and said, hey, can you write me a letter of recommendation? I want to work at FDA. And I say, no, I don't even know you. Mm-hmm. And the first time you reach out to me is to ask me for a letter of recommendation? Absolutely not. So making sure that you are adding value to your network as well. Making sure you're keeping your skills sharp. So whether that's education, whether that's training, asking for those stretch projects at work so you can grow and move outside of your comfort zone, or volunteering with organizations that help you expand your skill set. And then most importantly, it's really about advocating for yourself. In order for you to advance along your professional track, whether you're in government, nonprofit, industry, wherever you work, you are going to have to speak up and advocate for yourself, particularly as a minority person, particularly as a female. You are going to have to step up. It's not likely that many people are just going to say, hey, I want to promote you. You're going to have to go in there and say, hey, this is what I want my career trajectory to look like. Can you help me get there? What do I need to do to get to the next step? And then come back with your receipts. And this is what you've done. I think the old saying is closed mouths don't get fed. So you got to speak up. It's hard. It's challenging because we've been conditioned not to do so. But I guarantee you doing so will make you feel much better on the inside, and you'll be amazed at where you can go. Because if you don't ask, the answer is always no. At least if you ask and the answer becomes a no, you know you've done your part to at least see what the options are. And then if you get a no, then you can figure out how to turn it into a yes. That's a whole nother conversation.
Yeah, love it though, love it. Number 3, what's something you're working on improving in your life right now?
So probably I'm always working on self-reflection, self-improvement. So I want to make sure that every day that I show up, I'm showing up as the best version of myself. And I'm giving the world my best efforts. And that I am putting myself in a position to evolve and grow and not to stay in a constant state. and practicing consistently showing up as my authentic self and not dimming others. Making sure that my personality shines alongside my skill sets and my knowledge, and making sure I am speaking up and representing those who are not in the room, and really focusing only doing things that align with my vision. So even when I started Beacon Public Health, I said from day one, I am not chasing a dollar. I am only taking on those projects that I align with the mission and vision of the organization and that it aligns with me. I'm not just taking projects for the sake of staying in business. That's not how I want to run my company. And so giving myself the space to say no to anything that does not fit into that vision. Now, it can be at time because I am running a business and I want to run a profitable business, obviously. But I also want to maintain who I am in the process. And those who work with me will then know, okay, she's authentic, she's credible, she's trustworthy. I can align myself with her because I know she's about her business and she's only doing things for the greater good.
Yeah, love it, love it. Professionally, do you recommend anything?
Such as?
It could be that people have mentioned like resources, have said mentorship, could be literally anything.
So I definitely co-sign on the mentoring and also sponsorship, and recognizing those are two different things. And so for those who don't know, mentoring is really about the person helping to groom and shape you and help you navigate to your next level. But sponsorship is when someone is advocating or talking about you on your behalf when you're not in the room. And I actually have a very good example of that. So in Beacon Public Health, there was a colleague that I used to work with. She called me up one day out of the blue and talked to her, and she said, "Hey, this organization is doing I think you would be perfect to do it. I've told them that you started your own consulting firm, that you would be a good fit. So I want to make the connection on this level." I've worked with that organization capacity, and I've worked with this person before another capacity. But she spoke up for me when I didn't even know a project existed. There was no RFP to, respond to, but she knew they were doing the work and said, "Hey, Jovonni can do it for you." This aligns with her skill set and what her business is, what the business mission and purpose is. And from there, I've now started doing the work with that organization. So that's sponsorship. I didn't know she was speaking up for me. I'm grateful that she did. But that goes into, building those relationships, because you never know when they're going to bear fruit. So that would be one thing. I'm big on like podcasts. So some of my favorite podcasts right now are more the professional side of things. I definitely like listening to Therapy for Black Girls. Every morning, I usually start my day with NPR Up First, so I can just get a quick 15-minute, what's going on in the world. There's actually this really cool podcast. I think it's an Australian podcast called Health Report. And they kind of delve into like different like health topics and interesting health things. And then I like another one called Side Hustle Pro, which is more like business focused. So how do you turn your side hustle into your main hustle kind of thing? There's one book I would definitely recommend. It's called The Memo by Minda Harts. And actually, my best friend gifted me the book a while ago. And so I was very grateful for that. And most recently, I did watch a documentary on Hulu called Aftershock. It's about maternal health, but it really talks about it from the one piece is talking about it from the father's perspective. So the fathers who are left behind after their partners died during childbirth. Very, very heart-wrenching, but it very much put a face to this issue that we often don't see. So those are just a few that kind of come to mind.
Okay, awesome. Well, I appreciate that, and I'll be sure to link those in the show notes for anyone that is interested. And last but not least, where can people connect with you?
So come to beaconpublichealth.com. I mean, you can definitely connect with me personally on LinkedIn. LinkedIn is the best channel. For all of my personal, it's under Jovonni Spinner. And for all of Beacon Public Health, it is under Beacon Public Health for LinkedIn, Instagram, Twitter, and also Facebook.
Awesome. I'll be sure to link those as well. But thank you so much for coming on today, Jovonni, and sharing about your story, and definitely very inspiring. And I know a lot of people are going to take away some great insights from it.
Awesome. Well, I am so excited to be here and to share a little bit about myself and my journey. Hopefully it will help someone out there wherever they are along their career trajectory. And I definitely look forward to connecting to any of your listeners who want to reach out. So definitely thank you for having this platform to, expose people to, different types of public health careers and jobs, and, how do people navigate their lives and figure out what we do with public health. So I thank you for even having this platform. I wish I would have had something like this when I was in school to really, better understand what is public health and what I can do with it.
Well, thank you. And yeah, that's exactly why I created this, because I think it's something that's needed. So I appreciate you coming on and sharing your insights. Housekeeping items, everyone. Thank you so much for watching. If you're watching this or if you're listening to this, be sure to subscribe regardless. Leave a like if you're watching it. Leave a 5-star review. Share it with a friend. Greatly helps the show get out to more people. Greatly appreciate you all tuning in. And I will see you all next week. Peace.